There are wound care companies based out of state that send providers into nursing homes, but it's not the same as having a local provider. From your perspective, what are the biggest differences patients and staff notice when care comes from a local team like yours?
Sure. I think first is reliability, because we treat each facility, each nurse, and each patient as individual. So it's facility is treated like it's a small business, and with its own needs. Each facility has a slightly different relationship with surrounding hospitals, slightly different community of the patients that they're serving. So for local providers, for us, we're better positioned to recognize it. Reliability, because we're not cogs on the wheels. We're a very small, 10-employee company. We provide very, very personal care. So we're not part of large machine that's revenue based.
Mm-hmm.